All right, let's get into it. Today we're talking about a subject that, let's be honest, can be a little tough to bring up, but it's so important for men's health. We're talking about erectile dysfunction. And it's way more common than you might think. And understanding it is absolutely key, not just for your sex life, but for your overall health. So, just how common are we talking? Well, this number really says it all. A staggering 50% of men over the age of 60 deal with ED in some form. I mean, think about that for a second. That's 1 out of every 2 men in that age group. So if this is something you or someone you care about is going through, you are definitely not alone. Okay, so to make sure we're all on the same page, let's start with the absolute basics. What exactly is erectile dysfunction when we strip it all down? What's the medical take? Well, the clinical definition is actually pretty straightforward. It's the inability to either get or keep an erection that's firm enough for sexual activity. And it's important to remember, this isn't an all or nothing thing, it's a spectrum. For some guys, the issue is getting an erection at all. For others, it's more about maintaining it. The key symptoms are right there in the definition: trouble getting it and trouble keeping it. And this really helps put things in perspective. Having an issue once in a while doesn't automatically mean you have clinical ED. It's actually pretty normal for most men to have some difficulty maybe 1 out of every 5 or 6 times. The real concern, and when it's time to talk to a doctor, is when it becomes a regular, ongoing pattern. And that leads us to the most important first step: talking to a doctor. I know, it can feel like a really big hurdle. So let's just walk through what that conversation actually looks like, so you know what to expect. Your doctor is basically going to turn into a detective to figure out what's really going on. They'll want to know your sexual history, and hey, they might even ask about your partner's perspective, which can be super helpful. They'll go through any medications you're on. Things like antidepressants can be a big factor. They're also going to look at your heart and vascular health, and this is a big one. They'll explore the psychological side of it. Stress and anxiety can kick off this vicious cycle that just makes everything worse. Now, we're about to get to what is probably the single most important takeaway of this entire explainer. Because it turns out ED is so much more than a sexual health issue. It can actually be an incredibly powerful early warning system for your entire body. And I love this quote from Dr. Casey because it just nails it. The penis is an early warning system for the heart. And that's not just some catchy phrase, you guys. It's based on some very real and very important science. And this right here breaks down exactly why. It all comes down to plumbing, basically. The blood vessels in the penis are much smaller than the ones around your heart. So if you're starting to get blockages in your circulatory system, where do you think they're going to show up first? Right, in those smaller vessels. It's an early sign that trouble could be brewing for the larger vessels down the road. So how much of a heads up are we talking about here? Well, this is pretty wild. For about half of all cases, the start of ED can happen roughly 2 years before a major cardiac event like a heart attack. Just let that sink in. That is a 2-year warning, a 2-year head start to get on top of your cardiovascular health before it becomes a life-threatening crisis. Okay, so we've laid out the problem, we know how serious it can be, so let's talk solutions. For most men, the first line of defense is going to be oral medication. But before a doctor even writes a prescription, they're going to talk to you about lifestyle. And they have to. Things like smoking, in particular, are a direct cause of ED because of the damage it does to those blood vessels we just talked about. So while things like quitting smoking, changing your diet, and getting more exercise take time, they are a huge part of the long-term fix. So how do these pills, you've probably heard of them, like Viagra or Cialis, how do they actually work? Well, it's not like flipping a switch. First, you take the pill before you plan on being sexually active. And second, this is the really important part, you still need natural stimulation. The pill doesn't create the desire, it just helps your body respond to it by enhancing that natural process. Which, of course, leads to a question that's probably on a lot of people's minds when they first think about taking these. And the answer is a clear and simple no. You are not going to get an unwanted erection just from taking the pill. Remember, it only works when you're already aroused. So you can take it and go about your day totally normally. In that sense, the medication is considered really safe. Now, of course, like pretty much any medication, there can be side effects. The most common ones are actually because the drug widens blood vessels all over your body, not just in one place. That can lead to things like a stuffy nose, getting a bit of a flushed face, headaches, or even some indigestion. The main thing to know is that these aren't usually dangerous, and a lot of the time, they go away as your body gets used to the meds.
So, the million-dollar question. Do they work? Well, for about 70% of men, yes, these pills are effective. And that's a fantastic success rate. But it also means that for the other 30%, they might not be the whole answer. So what happens if you're in that 30%? What if the pills just don't do the trick? Well, the good news is the conversation does not stop there. There are other more advanced options available. And this table gives us a quick rundown of what's next. First up, you've got injectables. It's exactly what it sounds like, a medication that's injected directly to produce a strong erection that lasts about 45 minutes. Then there are vacuum pumps. This is an external device that draws blood into the penis, and you use a ring at the base to keep it there. And finally, for a permanent fix, there's a surgical option called a penile implant, which lets a man create an erection whenever he wants.
So look, from lifestyle changes to pills to these more advanced treatments, there are so many ways to address this. And that brings us to the final and really the most important message here. As the expert says, you are in charge of your own health. Ignoring a problem like ED isn't going to make it go away. Taking that first step, starting the conversation, is everything. It's about taking control,